to another episode of the Yaba Voice webinar. We're excited to have you join us today on this special edition of the Yaba Voice webinar. Why I call it special edition is more because, yes, it's the International Youth Month. And again, it's also a time where we get to celebrate ourselves because you are special. And that's why we are welcoming you all to this month's edition of the Yaba Voice webinar. Before we run off, the medical director is here and ready to welcome us formally to this webinar. Over to you, Dr. Lubenga Adekile Owoye.
Thank you very, very much, Dr. Kemi Akitoyese. I really appreciate you for the good work you are doing on this program. Good afternoon, everyone. I welcome you to today's edition of our regular webinar by Yaba Voice on topical mental health issues. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a platform of Federal Neuropsychiatric Hospital Yaba, Lagos, through which the hospital creates awareness and educate the populace on mental health issues. Today's topic is Beyond the Habits, Understanding Addiction, Breaking the Cycle, and Reclaiming Life. Beyond the habits, understanding addiction, breaking the cycle, and reclaiming life. As we all know, drug addiction is a chronic, long-lasting, relapsing, and recurring brain disease that affects the mood, the thoughts, the sensory perception, behavior, and sometimes consciousness due to the use of psychoactive substances that becomes the central point of individual's life. Meaning that the disease keeps coming and revolving in cycles. Hence the essence of today's topic. More and more young children and adults are now living in drug-like circumstances and are actively engaged in drug-using behavior. Recent data show that the incidence and the prevalence rate of substance use disorders among children are increasing across socio-economic strata. The World Health Organization reports even show that 90% of children living in streets, 90% of children living in streets, life circumstances worldwide, use some kind of substance. And this creates a large burden for the family, community, and a great danger for the future of the family and country in general. Hence, the need for the awareness and adoption of the preventive approach to this problem. In today's webinar, the following questions will be answered and more. 1, what does drug addiction mean? What are the factors responsible for it? How do we recognize the problem early? What are the available solutions? And to those who have the problem, how do we prevent or break the cycles? In today's webinar, I have experts in this field to deal with today's topic. Our first presenter today is Dr. Obatomi Alalade. Dr. Obatomi Alalade is a consultant psychiatrist at the Federal Neuropsychiatric Hospital Yaba, Lagos. He had his university education at Ladoke Akintola University of Technology, Oyo State, where he had or received a Bachelor of Medicine, Bachelor of Surgery. He then did his residency training program in Federal Neuropsychiatric Hospital, Yaba, Lagos. And from there, he proceeded to improve on himself and to develop more. He has worked in various cadres, worked with various organizations. Currently, is a member of several professional bodies. These include Lagos State Psychosocial Response Team, Nigerian Medical Association. He's a fellow of West African College of Physicians, also a member of the Medical and Dental Consultants Association of Nigeria, and International Rational Emotive Behavioral Therapies. His passion for mental wellness has led him to speak in various corporate meetings, media organizations, and religious gatherings with an aim of improving their awareness. He has received several awards, including one from the Lagos State government on his immense contribution to awareness and promotion of mental health in Lagos. Dr. Obatomi Alalade loves reading and giving talks. He is married to also a consultant child psychiatrist, and are blessed with two beautiful children. Our second presenter today is Dr. Olubenga Adamilare Koka. Dr. Koka is a clinical psychologist with proficiency in dialectical behavioral therapy, a cognitive behavioral therapy, and so on and so on. He has helped individuals and families shift paradigm and develop competencies for several and adaptive living. In addition to his clinical practice, Olubenga is a learning and development faculty in the corporate sector, where he designs and facilitates impactful mental health and wellness programs that foster psychological safety, culture management, and module operandi, work-life balance, leadership development, emotional intelligence, and productivity in the workplace. His integrative approach bridges clinical insight with organizational development, making him a trusted voice in promoting holistic mental health and purposeful living. Dr. Koka is an alumni of University of Denver, where he obtained Doctor of Psychology. He's also an alumni of the Business School, University of Education, Winneba, Ghana. You can see that our presenter today, they are loaded. So I want to encourage all of us to kindly sit and relax, to listen to our presenter today for a rewarding session. Thank you. Over to you, Dr. Kemi Akitoyeshi.
Thank you, the medical director, sir. Thank you for that arousing welcome. And from what the medical director had said, you would understand that this topic is so very important because the percentage and the number of people who are getting into the trap of substance, the number of people who are getting into addictive behavior, be it the substance use, be it the behavioral addiction, is on the increase. And we are in a world where trauma seems to be prevailing because quite a lot of events around us seems to be causing issues of trauma. And so many people are finding ways to deal with it. And substance and other addictive behavior seems to be the solution. Now, Dr. Oladade will kickstart this conversation for us. But before he does, remember the topic again is beyond the habit, understanding addiction, breaking the circle, and reclaiming life. And please, if you know someone that needs to be heard, please just reach out to them and tell them that we had started. They would need to hear this with their own ears so that it makes a whole lot of sense to them. So please reach out to them, tell them that these are started, and then they need to be able to join us as soon as possible. Now, Dr. Lalade would kickstart this conversation for us, and then he will be talking to us about what really drives addiction and why is it so difficult for people to even stop when they genuinely want to stop. So we're considering what exactly is addiction and what's the hook, what's the catch there. Over to you, Dr. Lalade.
Okay, thank you very much. Good day to everyone, the medical director and everybody on this call. Thank you for joining. The concept of addiction definitely is very important, and the medical director in his opening remarks gave a scientific definition of addiction, defining it as a chronic, relapsing condition wherein somebody develops a compulsive pattern of using a substance or engaging in a behavior despite the harmful consequences and difficulty in stopping it. But let's look at it a little bit more, and let me give a simpler definition. When we say somebody has an addiction, it simply means someone keeps using something, a substance or a behavior, or doing something because it has become very difficult to control or stop. And it could even occur even when the person knows it is causing problems in their life. And so from the definitions, it shows that the person keeps using the thing. So that means there's a difficulty in controlling the use, even when they want to stop. Then it becomes difficult to control. You hear things like saying, I will only do it once, or this is the last time, but the person keeps doing it. There's a strong craving for it, like you want to do, you can't stop it. And even when the person starts small, over time, the person starts increasing the use. And that's what we call tolerance. Sometimes when I start with a cigarette, taking a puff, and then before you know it, I'm taking 10 sticks of cigarettes. Now, there could also be withdrawals when you now confine the person or the person wants to stop, and the person just keeps having symptoms that show that, oh, I need to use it to just get normal again. And then finally, the person, it starts affecting their functioning in different ways, and that becomes the major thing they want to keep using. Now, addiction cuts across. Generally, we always say substance use like cannabis, methamphetamine, cocaine, cigarette, alcohol, and the likes. But there are addictive behaviors too, because there's also pathological gambling. Gambling is also an addictive behavior. Now we are talking about social media addiction as also a form of addictive behavior. So addiction is not only related to the use of substance. And this is key because what drives the addiction, like asked, it's about when I use something or when I engage in this behavior, it provides something that I need, something that I value. Like it could be pleasure, it could be relief, it could give me confidence, it could give me a temporary relief from an emotional or physical pain. And then I go to it because it's giving me that relief, it's giving me that pleasure. So some of the things that could then increase the vulnerability could include genetics and biology. A lot of times addictive behaviors could be genetic when you see a father using a substance and then the child now starts using over time, probably from modeling or the genetics itself. Sometimes mental health challenges could also lead to an addictive tendency, like somebody going through a depressive disorder, anxiety. Like I said, the relief from it to say, oh, I feel more confident, and then an anxious situation, or somebody who has an anxiety disorder, or someone who has gone through one traumatic experience or early life experiences or the other, like an adversity, something happened in childhood, early loss of a parent, could then lead to or predispose to the use of this substance. We all agree that our environment could also be porous because of the availability of these substances that could lead to it. And then the effect of the substance itself, when I see what it does to me, then I want to use it. Now, the difficulty in stopping, because that's the part B of the question, could occur because there's a difference between wanting to stop and being able to stop. Because there are people you talk to and they tell you, oh, I really want to stop, but they just find it difficult because of some of the things that I've mentioned earlier. So that becomes a bit of a contradiction to say, how do we stop? So difficulty in stopping may arise from some of these things I mentioned earlier and not getting the right access or the right motivation or the right environment to help the person to stop. So there is a big difference between the willpower of the person and the ability to then stop based on the current coping mechanisms or support systems that are available. I'll stop here for now. Thank you very, very much.
Thank you so very much, Dr. Alalade. You had opened the mind so wide to the so many problems that are associated with addiction. And you had also helped us to understand that we're not just talking about an habit. An habit could be nail biting or blinking your eyes or sucking your tongue. But again, this is more deeper because there's compulsion, there is craving, there is also tolerance there. And these are some of the things that you have identified associated with addiction. Now, Dr. Kuka would help us because when we look at addictive tendency, and somebody had also asked a question that we would come back to in the chat box. There's an increase in this behavior among young people today. So let's look at what are the psychological factors or other risk factors that are associated with this increase that we're seeing in our world today. Over to you, Dr. Kuka.
Thank you very much. Thank you very much. Let me say once again, to give honor to whom honor is due, to our medical director in person of Dr. Adekile Owueye and every professional that is on this call today. Let me start by saying this. It becomes very important that we know certain things very clearly, because if we do not know, we can be going around in circles. We can be going around in circles. So what are the psychological factors or other risk factors that are involved in this? We'll start with, like our doctor has mentioned, the genetic factors. Yes, like if it runs in the family, if there's an issue, a biological issue like that, yes. We also mentioned that when it comes to this genetic or gender factor, now we know that it is believed, and actually statistics confirms it, that male actually can be more predisposed, especially to addiction or dependence, than female. Then we also talk about personality factors. Certain individuals that have certain kind of personality disorders, we know are more predisposed to this particular illness, because it is important. It is not because they necessarily want to, but because of the particular or pathology that psychopathology they already have. So that makes it difficult or easy for them to move in this particular direction, or difficult for them to sit and actually engage in logical, analytical reasoning. Hence, they can become easily dependent on these particular substances or behaviors, as the case may be. Then we also talk about behavioral factor from behavioral theory, that every behavior is actually learned. So in certain environments where certain things are available, we know it becomes an issue, because when children grow, like the concept of tabula rasa says that a child is born with nothing. A school of thought also believes that children are born with all the emotions but zero coping skills. So when these children see these things in their environment, it becomes one of the reasons why they pick it up and they start doing it. Another factor is the cognitive factor, which the part where an individual thinks that, okay, something is wrong with me. If I don't take this, I will not feel this way. It becomes one of those reasons why individual can get hooked, can get launched on to that particular substance or a behavior. And at the end of the day, it can become a very or a serious problem. We also talk about issues with trauma, issues with abuse or neglect. We talk about mental illnesses like schizophrenia, bipolar affective disorder, or even mood disorder, basic things like that. When somebody is having a very serious depression, and people around are saying, why are you keeping yourself or giving yourself this very plenty trouble? Use this one and use this one. You see, you'll be fine and all will be well. So these are associated factors. We also have the cultural issues. There are certain environments, especially in this part of the world, where you hear things like alcohol is just one of the things that they do or they use for their everyday living. You hear things like sapele water, like that. So in that environment, if these things are just usually available, they use it for almost everything that they want to do at every given point in time. So there are chances, there's a very high chance that children that are born in such type of environment, or people that come to live in that environment over a period of time, begin to adopt as a method of coping the culture of their environment. And as a result of that, a lot of these things will happen to the point of addiction or dependence, as the case may be. So we also have characteristics, yes, like that. For some other persons, like that, we talk about curiosity. Curiosity. We say experimentation is part of learning, especially for young adults, teenagers, and the likes of them, like that. We talk about curiosity. We talk about family history. We talk about low self-esteem. Issues like low self-esteem can actually also precipitate this particular thing. We talk about easy access to this particular drug because of things that are available within our environment. We talk about factors like poverty or employment or unemployment or underemployment, which can make actually some people, they are disgruntled. They are not happy with how their life is going, what is happening in their life. So, and because of that, they begin to feel some way. They now want to feel okay, feel all right. And one way or the other, they get access to this thing and it becomes a thing. Say, for instance, a child that is failing in school, or academic or poor life achievement or underachievement can actually also be a factor in this particular case. When we talk about social isolation, it's also one of those things, especially now when we are in the age of social media, and you see the celebrities that we respect online. They pick those things and they are doing it, and it feels like if you are not doing it, you are not cool. Ladies and gentlemen, these are the things. Over a period of time, what the eye sees consistently, ears hear consistently, over a period of time becomes a problem because it enters the mind, and whatever enters the mind of a person has entered into their life. Let me keep it at this point. Thank you, ma.
Thank you so very much, Dr. Coker. That was huge. And I think our audience are taking notes because this is very, very important. Now, what we are creating now is an awareness, an understanding of the dynamics. Because when you understand this, it helps you to know what is going on and then how best to be able to treat this. Now, Dr. Lalade is going to talk to us about how does repeated use of substance or this addictive behavior, we talk about gambling, pornography, social media addiction, and all the things like that. How does it change the brain? How does it affect the brain? And how does it also affect individuals' functioning? What are those signs that you would see, and then the consequent reactions? Over to you, Dr. Alalade.
Okay, thank you very much. Very beautiful conversations thus far. When we talk about how this repeated substance use or addictive behavior, how do they change the brain and how it affects functioning? Number one, from the definition of addiction, I'll start from there. We say addiction is a brain disease, is a brain disorder. And people need to know that when an individual gets to the level of addiction, it's already a brain disorder. And so the blaming and looking like you are not changing, you are this and that, we need to understand that something has occurred to the brain. Maybe if I can put it in the way of saying an insult that needs to be worked upon. Now the question is, how does it affect the brain? What goes on there? And it's very simple. Repeated use of substances or anything that gives pleasure teaches the brain because there's a reward from it. So I smoke marijuana and I feel calm, I feel cool, I feel I can think better from it. That is a reward. And so when I get that reward from it, anytime I feel stressed again or I feel frustrated, my brain just remembers, oh, the last time you used this thing, it worked, right? Remember it worked. Try it again. So the first time I used it might have been a choice, might have been experimentation, might have just been a peer pressure. But then I find myself in a similar situation. And because I got a reward from the previous time I used it, then I will go back to it. And so it works, remember it, seek it again. So addiction works in such a way that it affects the reward system. So to break it down so that we don't say too much, right? And because of the audience, when we say reward system, It's just a brain's network way of helping us recognize and then repeat things that are pleasurable. So I eat, I'm hungry, I eat, I feel some pleasure, it feels good. I drink water when I'm thirsty, it's still the reward system. I feel good about it. I achieve a goal. So once all these things are done, the reward system in the brain produces dopamine, which is a chemical. It makes you feel good, like, oh, you did this, well done, kudos to you. It releases those chemicals. But in addiction, the release of that dopamine may now become very, very much higher than normal release because some addictive behavior and substances activate that system very strongly. And so it's worked before. I'm frustrated, I'm stressed, I have no way of coping. Let me smoke, releases dopamine, I feel good. I get frustrated again, I go back to it, and it keeps releasing it. Before you know it, my body system gets used to it because with repeated use, the brain becomes very sensitive to those cues associated with the substance. So what are now the cues? You know, you now say, oh, don't go around where you smoke, don't stay with friends, because sometimes just seeing an advert that shows somebody drinking might just be the cue that will remind my brain to say, oh, this drink is very good and I want to take it again because of the reward that I get from it. Or somebody that bets then sees an advert or follows any betting company and sees it and say, oh, wow, I remembered when last I bet, oh, this was the reward. Let me go for it again. So in addiction, the brain is now very used to it, so that the reward system is overactivated because its works is now focused on the addiction. So different cues can then become a trigger and then becomes very powerful when the person feels lonely, when he finishes work at the end of the day, when he's passing a location, the brain just gets activated to say, oh, this is where you buy it, take it. You just face stress, take it. So over time, tolerance and withdrawal then develops. So something that probably now started with, I'm using this thing because it makes me feel good, then becomes, I feel terrible without its use. And that's the addiction. So some of them, it's not now about the feel good feeling. It's about if I don't use it, this is how I would feel. So they don't want to feel that terrible, then they continue to use it. So with that way, it just becomes something that I have a control over is now controlling me. And that's how it happens. Then the brain is already rewired, is already addicted to it. And over time, if marijuana is not doing the trick again, from one puff of marijuana, it becomes two, from two, it becomes three. From SK, if SK is not working well, then I move to loud. Loud, I move to colos because my brain has been rewired because of all of these things. Same thing with other forms of addiction. That pleasure that we derive normally from every other thing we do, addiction, it increases more. So in mathematical terms, let's say if I eat, it gives me 50 units of dopamine. If I smoke and it gives me about 200 to 250 units, if I use methamphetamine and it gives me almost 1,000 units, then I would rather do that because it's increasing that reward system and that's where the addiction comes. So how does it affect everyday functioning? Addiction affects every part of one's life. You see people that they are doing well in their academics and all of a sudden there's a nosedive because they are now addicted. They see no reason to go to class. The drive has gone down. They see no reason to pursue their academics. Some, it could be their workplace. You just start seeing everything goes down. Some, it could be their relationship. And right now, they are not talking well to family members. The relationship with family members is no longer cordial because of the addictive tendencies. You say, oh, that man is irresponsible. He's not providing for his family. Where is the money going to? He's become addicted to alcohol. And then he doesn't care if the children's school fees has been paid or not. So it affects family functioning. It affects occupational functioning. It affects relationships. It could also become affecting performance at work, affects finances, affects concentration, affects memory. It even affects judgment. To decide on something, you just take decisions that you know if the person was not dependent on a substance, may have not taken those decisions in that direction. So when it comes to the functioning, it affects everything, including one's time. I'm sure you probably had someone missed an appointment or someone did not make something because it's already wasted or already dependent on the substance. So addiction is a brain disorder, a chronic one. And that is why they deserve, anybody that is addicted deserves empathy and not necessarily always a blame, because we have to help them through the process. Thank you very much.
Oh, Thank you so very much, Dr. Olalade, for that last word that you said. And they deserve empathy rather than blame. And that will lead me to ask Dr. Coker, because if we were talking or we were saying that addiction is often a symptom of a deeper pain, then what are we missing when we focus solely on stopping the substance rather than understanding the person behind the addiction? So is there a gap? What's the link? Over to you, Dr. Coker.
Thank you very much, ma'am. First, I want us to understand this, that everyone in the health space, in the human space, we are in the business of compassion. And like Dr. Lalade has actually emphasized, it is important that we remind ourselves and that we keep reminding ourselves that this is our call, this is our duty, this is where we are at. Because if we know that, we know that everything, every house that is tilting at the top has a problem in its foundation. And if the foundation is faulty, it is very important that we look beyond what we see, even down, deep down into the path that we are not yet seeing, so that we can understand how this individual, what are the things that led this individual into this space, and what we can do to actually help this person get back their life on track and they live a healthy, happy, and flourishing life. So, what are those things that we are missing, and what are we supposed to do? Number one, we need to understand what are the root causes. What are the root causes? That is why, at any and at every point in time, treatment must be individualized. Ladies and gentlemen, one plan does not serve everybody, just like one size does not fit all. So treatment must be individualized. When we know what the root causes are, then we are able to tailor for that particular individual what is going to help them based on what they are lacking. And we are not just focusing on what we want eradicated. Then another part of it is that every individual must know, parents must know, especially that see what rehabilitation or abstinence or recovery mean to you may not necessarily be the treatment goal for that particular person at that phase of their life. It is important that we know so that we are aligning our expectation with the professional's treatment goal, with the individual in rehabilitation or in treatment or seeking treatment, so that we are not over expecting and burdening them or being disappointed by the reasons of the things that is happening. So we address mental health problems in individual. If it is true that when people are depressed, when they are sad, when they are hearing voices, hallucinating, they take substances so that it can calm down or they can boost their mood. Yes, when we address these underlying issues, we'll discover that their life will be good when those distresses are reduced by observing and actually assessing their subjective unit of distress. So we are able to help them. When we are able to help them, they do not see any need to use these substances as coping skills anymore. Then the provision and access to treatment. This is very, very important. In Nigeria today, treatment is gradually becoming very, very expensive. Even in government-based organization, faith-based organization, and the rest of it like that. There are some things that we need to do so that one, the provision is made available at an affordable cost. Then number two, that access, the average person on the streets can actually have access to the pre-treatment, even to the treatment in itself. So we talk about stigma. And I said something the other time. I said if celebrities are smoking, they are drinking, they are doing certain things that are maladaptive, you understand, and they make us feel like, oh, it's the way to go, it's the norm. Maybe it's also time that we start using celebrities in actually doing these things. We bring them in and say, see, if you have a problem, they start advertising it. They start talking about it in their shows, in their programs, because a lot of people, they have a large following. So these people that are following them, when they see that this person too are beginning to, then we bring the individual in that talk about their own challenges so that people can learn from it and they can start moving. So we talk about that one because stigma will make people withdraw. And when they withdraw, it will affect the time where they get help or they seek help, if they ever do. And it will affect the time when they get help and the things that has happened, the changes, permanent changes that has happened in their brain. We address things like family education is very, very important. Very, very important. About 6, 7 years ago, many years ago, maybe about 10 years ago, we saw a 3-year-old that was already addicted, not in Nigeria, because the father's friends will come around and they will smoke, and they will give the stump to the boy, and little by little, at that time the boy was smoking over a pack of cigarettes daily, like that, until they took that boy. I did not know what become of that boy, because those are things that we see from the environment. They are behavioral. So the boy saw and he practiced what they were doing until he became hooked on it. And we know that the age of onset also determines how well an individual will be able to actually live with or without that particular thing later in life. So we address families so that we understand that every dynamics in the family affects the individual child, and whatever the child becomes is a reflection of what is obtainable in the family as the smallest unit of the society. Then we also talk about preventing relapses. Is very, very important. Very, very important. As we promote abstinence, we prevent relapse. As we promote abstinence, we prevent relapse. When I say promote abstinence and prevent relapse, it means that not only people that have not used, even people that are already in recovery, so that they don't get to the point where they go back. That is one. And the other part of it also prevents relapse. What are those things that they can do that can help them stay put? So number one, family should know, friends should know, individuals should know. If it is you too that is listening now, please know that panicking does not solve that problem. It does not. It will just exaggerate the issue. So we know, number one, that there's no reason to panic. We just know that this is a problem and every problem has a solution. That is one. Then number two, we seek help from the right set of persons, from professionals, from individuals. And you also can do a self-assessment and ask yourself, why am I doing this? What solution is this thing giving me? Because we all know that if the brain does not enjoy an activity, it does not release the energy to carry that activity out over and over again. So there must be a benefit to it. So what am I benefiting from this particular thing? And from there we can take it up to a friend, to an individual professional, or to the larger house. So these are very important. We need to take note of these things so that we are able to do well at every point in time. Our job is compassion. Be compassionate towards yourself and start from that point. Thank you, ma'am.
Thank you so very much, Dr. Coker. There is a lot intent in how to begin to look at addiction so that we are better able to manage it. But one of the things I've also found out in terms of management and maybe people who are living with or who would address as addicts in one form or the other has to do with the fact that there's a shame that is associated with it. Sometimes family members don't talk about it. We hide it, we cover it. And then there's a tendency that it tends to spread, or it tends to be in such a way that it keeps degenerating and affecting the individual. So why do people delay seeking professional help when it comes to addiction? Now we're talking about whether it's substance or the behavioral type. Why do people sometimes delay seeking help or getting professional help, and what needs to change in the way that we talk about addiction? Over to you, Dr. Alalade.
Okay, thank you very much. Thank you to Dr. Kokatu for very brilliant responses to the questions. Thank you. So why do many people with addiction delay seeking professional help? I think for me, the number one thing is knowledge or information to know that there is help available, or to first understand that there is a problem. A lot of people are probably in denial, or they are ambivalent about it. You hear some people say, I can control it, or I'll stop next week. They don't yet see it as a problem, or they are still denying it, that it has become a problem. And so because of that, they delay in seeking help. Even it happens in families. You just see the mother or the father still feeling like, okay, we can manage it. It's not yet out of hand, or we can find a way around it. We just need to talk to him and everything. So the delay is the first thing. There's a denial or an ambivalence to face the truth that truthfully there is a problem. And the reason for this denial is more often than not related to stigma. How do I mention it? How do I say that, oh, my child is battling an addictive behavior or an addictive tendency or something like, how do I say it out? So the stigma is almost related to the denial, even when they finally say it, because it's a question of how do even stigma for the person, stigma for the family, for the individual, it could be a thing of how do I admit that I need help? How do I confess? How do I say it? How would they see me that I need help for this thing? I've seen people who are highly placed, even religious wise, like, oh, I'm the head of the choir team. How do I tell them that I'm so much addicted to marijuana use? Or how do they know that I'm now in a rehabilitation center for this addiction with my position in church? So we still experience a lot of stigma to it, and because of that, people delay in seeking help, people delay in wanting to talk about it. And some others also see it as I don't need treatment yet, let me just be managing it. That could be there. There's also a concept of shame and fear of being judged because if there is high hopes for a child and the kind of family you've come from, very strict authoritarian family parenting, how do I tell my mom that I'm really battling with cocaine addiction, or how would they take me with all the money I'm spending on you? While we are not saying parents or people should rub the head of their words and say, no, you've done well smoking. No, but it's about, would I be accepted? How would I be able to say this? How would I be judged for my action? So sometimes because of those things, the individuals then seek deeper because whoever you want to go and ask for help may also be the same peer that is also smoking or using this thing, and then the individual just gets deeper and deeper in it. So sometimes the shame, the fear of judgment, or when the individual thinks that there is no much support for me, like the supportive system, to really be able to say, okay, I live in this area or this family wherein I can tell them my challenges and they can help me. That could also be there. Then even when it is said, like I said, knowing where to go or knowing who to go and meet is also part of the situation. Some people may probably not want to delay, but because lack of knowledge or access, and you still find people, oh, they do this over here, or is there a private center, or where do I go? So sometimes the lack of knowledge or access, even for those who genuinely want to, some don't know where to go to. So that is also there. So they may not know where to seek help, they may not even recognize that the addiction is something that can be treated. And so some people may just have given up. So sometimes they could delay help. And when you seek information, some people will probably think that a rehabilitation will cost them an arm and a leg and will be like, oh, you want to spend all the money that is not available just to rehabilitate you. So knowledge is power. Even if just seek how much it costs, know what it's all about before the process can then start. At least having that knowledge is important. Now, how do we change in the way the society talks about addiction? It's very important that, like I said, we're talking about addiction, which for us is already a brain disorder. So the society have to just understand that this is a mental health problem. It is, yes, it's a societal problem, but the individual involved already also has a mental health problem. So it's not about asking the question of why don't they just stop? They must also see it as a thing of maybe something else is going, maybe something deeper is going. So it's more of a cry for help, a way to help the individual, a way to be empathic to the individual and see how we can support the person. So addiction can be discussed in the society with compassion and not that of contempt. So you see somebody addicted to something and they are like, oh, it's a bad child, it's a wayward child, don't move with him, don't move with her. May not have started that way, but the person is already under the control of that addictive behavior. So it's more of a compassion rather than contempt or being judgmental to say, oh no, this person's life is already wrecked, is a junkie, is a drunk, is very important. The society also needs to know that recovery in the part of addiction is not a straight line. So you just feel like, oh, this person is addicted. Once it goes, then the person is fine. Why are you going back to it? You should know that recovery is a process. And the support system is very key, because even the society is important in the support system. If in the society all the laws and implementation of it is there to say that yes, marijuana is truly illegal and must not be found, or just the job the NDLE is doing recently, busting a cartel for cocaine, KC luxury, and you keep publicizing it, people are saying it that okay, these things are dangerous and everything. The society in also raising alarms when we suspect it is also very key. So they must particularly not to lose that train of thought. Recovery is not a straight line. And so the society must be there to know that and also accept and support the person. Society can create friendly environment. So when somebody comes back from a rehabilitation, is not seen as an outcast, but rather a reformed person who must support in that recovery line based on, oh, you see this person there. Back then they say a child is not trained by only his family members, but the society. You are going there again, I'll report to your mom. You are not meant to go there, this and that. It's also very important. Then the treatment also addresses the whole person. We must know that management, obviously, the society would know that it's not just only like an addiction. There could also be underlying things which will be managed. Then we need to replace judgment with hope. We need to replace it with it is possible. The society needs to be less judgmental, and then we must also create things within the environment that the person can flow into. A lot of times when people are rehabilitated and get back to the society, the support system is not there. What job can they do? What work can they do? What can they fit into? What structure is available? So that can be provided to be able to help the person. So it's not just coming to the hospital and then going. It is about everybody helping in training or assisting the individual to be a better person, and the society has a lot of role to play. It is not about contempt, but compassion and support in the whole system for the individual. So that's where I would end it in terms of what we can do. Thank you very much.
Thank you so very much, Dr. Olalade. Dr. Olalade has dropped very important nuggets that I feel for every one of us on this call today, we can take home, read us. And no, very recently, he mentioned the fact that recovery is not a straight line, it is a process. So when this individual in recovery either relapses or what have you, we would not begin to blame them or make them feel like an outcast. I heard him use that word, that even when they come back, we should not make them feel like an outcast, but rather we should find a way to, incorporate them into the setting, the family setting, the home environment, the work and space, and then allow them to find their feet and then be able to move on again. So every one of us has a role to play, but it's more about compassion, and that's what he ended with. Now, Dr. Coker will be talking to us the fact that if addiction affects an individual's functioning, which we had established in the course of this webinar, then what can we do differently now to help the individual, the family, and even our nation as a whole? Because I think it was Kalala that mentioned some few minutes ago that said it's a cry for help. Some individuals are actually, they really need help, but the only help they could get is using substance or gambling or what have you. Now, what can we do differently? Over to you, Dr. Coker.
Thank you very much, ma. It's important at this point, like Dr. Alalade has said, that we understand that the things that brought us here cannot take us where we want to be or go. If it can, it would have taken us there already. So what are we supposed to be doing? How are we supposed to be looking at these people? And what are the things that we need to put in place? Like I said earlier, that denying will only prolong the struggle. It will only prolong the pain. And it is very, very important that we do not panic. Like we used to say, there are critical comments, hostility, and issues with emotional over-involvement, looking over their shoulders every time and anytime, will only overwhelm them. Helicopter parenting, it will only overwhelm them. So I know you are overwhelmed, but you need to calm down. So, what are the right things that we need to do or that we can start doing? One, we first of all know that there is a problem. Acceptance is very important before recovery can happen. What we deny, we do not seek help about. And what we don't seek help about is gradually going to eat us up or kill us. So, one, we accept that there's a problem. Then, number two, we accept the responsibility and commit to treatment. One, accept that there's a problem. Two, take responsibility and commit to treatment. Then, number three is that we make sure that we look for, don't accept the excuse that I've checked around me, I didn't see. There's not so much I can do. I have lost the job. I have done this one. I have done that one. No. Whatever you have done, you say I've done most I can do. Whatever you have done has not been able to help or is not good enough. So there's another stage. If there are new things we now need to learn so that we can know, and when we know, we begin to engage at another level entirely. So, yes, this is very, very important. So, we seek help, we find help, and we use this professional help. Another part to it, which is number four, is that we can actually go to the point of understanding that, see, if this group of people, social relationship that brought me here into this particular substance are still a part of my life, there are no chances that I will be able to do very well in the future. So we cut gradually or cut completely from certain things that pull us back. So, and understand that I need a new circle for a new behavior. Like someone has said, the association that you keep determines what follows you every day of your life. So, watch your company and you will be able to watch what accompanies you every day of your life. So, where am I now? Who do I need to be like in another 1 year, 2 years, 3 years, especially when it comes to rehabilitation, personal rehabilitation, and group rehabilitation? So we find a group, we call it your tribe. So find your tribe, people that you aspire to become like, and try, make effort to join them so that they inspire you on daily basis. So we avoid things that actually triggers us. These are very, very, very important. Then from avoidance, we gradually expose ourselves, then master the triggers so that we can start living above them. Because avoidance cannot work for life. Then another part is that we develop healthy coping skills. We say these are behaviors. Behaviors are not changed in isolation. As we are removing one, we are replacing them with other things. So that is a total lifestyle modification. When clients come for rehabilitation, we tell them, when they come for therapy, we say, you are not only changing a part of your life, we are changing the whole of your life, because the essence of learning is behavior modification. And that is why in Learning Process 101, we used to say that learning has not taken place until there is a relative permanent change in behavior.
I think
So after
it
that, we
froze.
bring that, we repair our relationship that has ruptured step by step, and we start building trust, because we know that for substance users or anybody that is hooked on drugs or other behavioral dependence or addiction, one of the things that they lose is trust. So these things are important that we know and that we start following them one step at a time. Then, lastly, please do not forget, we are never out of recovery. 20 years from now, we are still in recovery. So we should not develop that Dunning-Kruger effect or grandiosity inside of us to say, I am now above. No, we are forever in recovery. We are only changing phase or stages from one level to another level of recovery. Thank you.
Thank you so very much, Dr. Okoka. I love what you started with when you started your response to that question. And you said the things that brought us here cannot take us to where we want to get to. Otherwise, we would not be here. And for me, that resonates so strongly, because we need to understand that we are creating more problems, and the habits that or the addiction in its different forms now will not help us to be able to deal with the realities that we're trying to deal with. Thank you so very much. I'm going to quickly just take comment from the chat box. Afolabi Ajumobi says you become dependent on your addiction. Shubuola says, good day, please. How do we handle other forms of addiction apart from drug addiction, pornography, and other things like that? And I think that has been addressed very well by our expert today. Yes, Afolabi said stereotyping, yes. Banabi said post-rehabilitation and relapse is a major challenge. How do we prevent the relapse? Dr. Lolade, can you quickly just take that for us? How do we prevent relapse?
Okay.
So then if you have any other questions, please, you can just drop it in the chat box.
Okay, thank you very much. So preventing relapse. I remember very well that in the cycle, when we talk about pre-contemplation to contemplation, decision, action, the last year is always relapse. The truth is, we must always know, first have an open mind that when we are managing a client, there's a possibility that the person may lapse. But that does not mean that when the person lapses, he has gone back. We need to give them the support. Dr. Koka mentioned that recovery, you never come out of recovery. And so to prevent a relapse, the person has to constantly engage in the things and the support systems and the structures that were placed for him. Are you coming regularly for your therapy sessions? Are you engaging in the coping skills, in the stress management, in the getting something to do, in the identifying the cues and trigger, in everything that has been taught? And with the right support systems and structure, then things will get better. However, we must always give them to know that they can constantly tell us whenever it looks like they want to relapse or lapse into it so that we can quickly catch it and help them. So those are part of the ways to help. Follow-up management is very, very key in all of this journey, and not just leaving them to say, we have come from rehab center, you are fine already. We don't have any job to do again. Recovery is a continuous thing. Thank you very much.
Thank you so very much. Our time is almost up, and so we'll begin to wrap up. And then I'm going to start with Dr. Koka, who is going to give us a takeaway from today, because one of the essence of what we're looking at today is reclaiming lives. And so if you could give one message to anyone on this call today, individuals struggling with addiction, people who will still watch later after now, what is that thing that you would say to them, Dr. Koka? Dr. Koka, is he here?
Yes, I'm here. Yes, can you hear me?
Okay, all right, please. Yeah, we can hear you now.
So, yes. So, finally, I want to say this, that it is important that you keep your hope alive. Keep hope alive. Even the anchor of faith is hope. See, when there is hope, there will be life. Those people that are taking their own life is because they lost hope. So keep hope alive. There is actually no problem that does not have a solution. That you have not gotten it yet does not mean you will not get it. So keep hope alive and keep searching. And I tell you, step by step, you may not be what you expect to be, but you are already in the making once you keep hope alive. So keep hope alive, keep looking for help, keep finding help, and maintain the process. Stay in the process. Don't exit the process, regardless of how long you have gone in that particular process. Is very important. Thank you, ma.
Thank you so very much, Dr. Koka, for that. There's a question that just came in. Dr. Lalade, I want you to take that with your wrap up. How can organizations who wants to signpost get a database of recovery professionals and centers where they can get help? Are there facilities? Dr. Lalade, can you just take that with your own wrap up, please?
Okay, thank you very much. Yes, there are facilities available all over Nigeria. There are government-owned facilities, there are private facilities, there are faith-based facilities. I'm sure sometimes if you come over to our center in Yaba, we can always put you through with some of these other facilities available, or sometimes a search on the internet can also show some of it that is available, but there are facilities available for help for anyone needing it, including, like I said, the faith-based facilities. Truth about it is addiction is a very serious chronic brain disease, but there are testimonies of people who have broken free from it and are doing very, very fine. Someone 2 days ago who now runs a big foundation on addiction, helping people, celebrated 9 years of his recovery journey. But right now, he now has his own center wherein he's helping those that have become addicted to various substances or behavior. So that tells you that it is possible, no matter how deep-rooted the addiction is. Seek help. Come over. We are ready to help you. Yaba has robust mechanisms to help. Yes, so we are ready to help you to make sure you get better. And thank you to the person that put it on the chat box. Yes, I was trying not to mention his name, but that's his name. Coach David celebrated it. So please come around for help. Let's help you. Let's support you through the process. And with your willpower, everything is possible under God. Thank you very much.
Thank you so very much, Dr. Alalade, Dr. Koka. Thank you so very much for being here today. Today we had looked at Beyond the Habit, understanding addiction, breaking the cycle, and reclaiming life. Now we understand that there are gamut of problems out there. We understand that the world is changing, the dynamics isn't looking like what it used to be before. And we also know that people are exposed to quite a whole lot of vices than it was before. But there are protective factors around us. There are things that we can do, and there are places also that we can go in terms of getting help. And I would say that the Federal Neuropsychiatric Hospital, Yaba, Lagos, under the leadership of Dr. Lubenga Dekile, seems to have one of the best facility me to say in the nation. And like we had also mentioned, there are also organizations, there are also faith-based centers also who are also doing their own bit to ensure that we deal with this. Now, remember that what we have spoken about today isn't just about substance addiction alone. Now, there are lots of other forms of addiction in terms of behavioral addictions that people are getting into. But the most important thing is recognizing, identifying early, and getting help. There is no shame in it. Please get help. It festers when you do not get help. It festers when you run away or you try to cover it. So it's important that we get help. A child, pornography and other things like that, it's with the mind. And like we had said, addiction is a mental health problem. It's not something that you play with. It's not something that you just wish away. It's a mental health problem that needs to be adequately dealt with. For everyone that has been on this call with us today, I want to say thank you for joining us again. Please be our vanguard, spread the word. We're trying to do our own beat at Yaba Voice of the Federal Neuropsychiatric Hospital to pass information out there to everyone to understand, more importantly, the issue of mental health. It's around us and we must talk about it. Otherwise, it starts affecting us and then we're not able to deal with it again. So until we come your way again, by the grace of God, the third Thursday of September, where we'll be looking at something else. September seems to be the month of the suicide prevention month. So we'll be talking so much about suicide and the realities around us. Until then, please stay safe. So on behalf of the medical director, Dr. Lubenga Dekile, and every member of the Yaba Voice team, I want to say thank you for being here today. Please take care of your mental health. Remember, there is no health without mental health. Bye.